Hello. What's up? No, I'm not doing anything right now. Yeah, definitely. I can come pick you up right now. No problem. I'll see you soon. Hello, Mom. Hey, sorry, I can't make it. I have to go to work. Something came up.
Good afternoon, Miss B. What brings you in today?
Well, I had to walk to the grocery store the other day and I got a blister from the shoes I was wearing. It kind of turned into a little bit more.
Okay, let me take a look. You're not really experiencing any pain?
No, it doesn't hurt.
Okay, and have you been keeping it clean?
Yeah, I've been sanitizing it as much as I can.
Yeah, there's definitely some necrotic tissue there. The first thing I'm going to do is palpate your dorsalis pedis artery. I'm also going to palpate your right posterior tibial artery. Okay, great. I'm going to order a few blood tests.
What's up, Doc?
Hey, do you have the blood work for Miss B?
Yeah.
All right, so just as a background, she does have a history of type 1 diabetes. She has been taking insulin for 40 years. She has a history of high blood pressure. She's been taking an athiazide diuretic. She's a non-smoker, rarely drinks. She does have a history of bilateral intermittent claudication. Palpation shows poor blood flow to the right lower extremities, and although she has had a history of intermittent claudication, she denies any symptoms of pain, numbness, tingling. Let's go ahead and take a look at her blood work.
Okay, so we got high fasting glucose, high cholesterol, HDL is very low, LDL is very high. She also has a fever due to infection, and then she has a high blood pressure.
Okay, so I would suggest that we admit her for hospitalization to keep an eye on the wound since there is necrotic tissue and lack of pink granular tissue, which means it's not healing. And I would say that we start her immediately on a broad spectrum antibiotic as well as an intravenous insulin drip.
Sounds good.
Hi, Miss B. How are you?
Good, how are you?
I'm well. Is this your son?
Yeah, I'm so proud of him. He works so hard, helps support me.
Fantastic. It's always nice to be supported. So blood work shows that you do have an infection, and because of the severity of the infection, I'm also going to recommend hospitalization.
Hospitalization?
Yes. Blood work shows elevated temperature, elevated white blood cell count, and so we just want to be on the safe side. Because of your history of diabetes, I'm going to suggest an aggressive broad spectrum antibiotic treatment along with an intravenous insulin drip. And we need to get started right away. And I'm also going to issue a blood pressure test as well for that lower right extremity.
Okay.
All right, let's.
Excuse me, guys. I got a call.
Does it work again?
Oh, yeah, it definitely is. I'm out.
We did get our test results back, and tests confirm that you do have peripheral artery disease of the lower right extremity. There is poor perfusion, which is why the wound is not healing, and due to an accumulation of atherosclerotic plaque, blood flow to the area is very limited. So we are recommending an immediate stent to clear that obstruction. If we don't clear that obstruction, you risk losing your foot.